Let's look at a few oral cavity instruments, guys. Very easy, what is this one? This is a tongue depressor, or it can be also called as a spatula. It's lax, L-A-C-S, okay? Not looks, it's lax, L-A-C-S or L-A-C-K-S, okay? Remember, when and all you will use this, you will use it for posterior rhinoscopy. You can use it as a tongue depressor, obviously. And then you can use it in cold spatula test, guys, like this. Right, you can see the mist forming, and then here you can use an Irwin-Moore sign for tonsillitis to you'll press on the tonsil anterior pillar and get exudate, right? So that is the use of tonsil tongue depressor. Then ideal mirror. See, when somebody told ideal, no, I wrote it down as IDEAL mirror. No, it's not ideal mirror. It's indirect laryngoscopy mirror. Okay, what is this and the procedure and all you should know. Basically, you can see the mirror is always like this, okay, but in the handle there is no bend. The handle is straight. You should understand. This is indirect laryngoscopy mirror, okay. Then this one is posterior rhinoscopy mirror. You can see the handle has a bend so that the hand doesn't come in the way of visualizing the posterior back part of the nose. So look at this. This is how they are doing posterior rhinoscopy. We told you the tongue depressor is used to do posterior rhinoscopy. Along with that, what will they need? The posterior rhinoscopic mirror. This is the St. Clair Thompson posterior rhinoscopy mirror. What will they visualize in this on all? You should know the procedure also. How will you hold it? You'll hold it like a pen, the mirror. Then what will you do? One second. So basically, you will use the tongue depressor and you will introduce the mirror which has been pre-warmed, right? You'll use a spirit lamp or something. You can warm it. Then you will test it on the back of your hand so that it's not too hot or something maybe. Then you will hold the mirror like a pen and you will carry it to behind the soft palate without touching anything. You will examine, right? Without touching it on the posterior third of tongue. To avoid gag reflex, light from the head mirror is focused on this mirror and you can examine, okay? If you touch anything, what will happen? There'll be gag reflex. You have not given any local anesthetic, looks like, okay? So what happens here? The patient should be relaxed so that the soft palate does not contract. What and all can you see? You can see any choanal polyp if it's there. If there's choanal atresia, you can see that. You can see any hypertrophy of the posterior end of the inferior turbinate. Inferior turbinate's posterior end they are talking about. From the middle meatus, is there any discharge that is coming? Any infection can you see of these sinuses? Then can you see the discharge again they are talking about, right? That's it. Let us look at the diagram which tells you what and all you can see in posterior rhinoscopy. Here they're telling you there's adenoids. Here you can see posterior end of turbinates. Which turbinate? Here you can see the opening of the eustachian tube, the tubal torus tubaris, which is around the eustachian tube. Then here you're seeing upper surface of soft palate. Structure seen on posterior rhinoscopy. For some strange reason, they did not include the eustachian tube or something in this list. Okay. So guys, let us look at Hartman's serrated crocodile. What is this? Crocodile? Forceps, is it? Yes, it is a forcep. And again, this is going in the mouth or actually, where is it going? Actually, they are saying it is bronchoscope, esophagoscopy. They are taking biopsy. So basically, this is a crocodile because you see crocodiles will open their jaw, the upper jaw they will open. Unlike all human beings, we all open the jaw downward, right? Only crocodile will open it upward. So you can see the crocodile will open it upward. So that's why this is crocodile. What crocodile? Hartman. Does it have a heart, this crocodile? I don't know. Yeah, it has maybe, but not when you're in front of it. It doesn't use it. And serration. Serrated. Hartman. It will eat men with heart. That's all I can see. So that's why it's taking a biopsy. What do you say, people? So this is your Hartman serrated crocodile forcep. I kind of gets confused with Blakeslee and this one. But anyways, just see this is Hartman serrated crocodile forceps. That's it. We are done with some instruments from oral cavity. Bye-bye.